Hey everybody, sorry about the delay today. Dr. Patel here. Today we are going to be going over hand and wrist arthritis. So, what does that mean? What's a little bit of the anatomy of the hand and wrist joints? And how is it that we get arthritis? And why is that important? What causes arthritis to be worse? What causes arthritis to be painful? Is it always painful? What exactly is going on when you have hand or wrist pain, and is it always the arthritis that we can potentially see on x-ray or imaging? So if you're new to my channel, basically I am a physical medicine and rehabilitation doctor specializing in sports medicine and interventional pain management, with a focus on regenerative medicine, orthobiologics, using your own body's healing factors to improve your pain conditions. And we've been talking a lot over the course of the last few months about different body regions. We've talked about the knees, we've talked about the low back, we've talked about the neck. And one of the common things that we talk about is pain, and particularly when joints have osteoarthritis that causes pain. So now for the next couple of weeks, we're going to be talking about the wrists and hands and what are the different things that can cause issues in these areas. If you want to see any of our old videos when we're talking about the knees, back, neck, shoulder, etc., feel free to visit our website, fxregencenter.com, or you can look us up on YouTube. Our videos are available in both of those areas, as well as on Facebook. If you guys have any other specific topics that you want to talk about, if you have questions about your hands and your wrists specifically, or if you want to talk about other things, then again, feel free to reach out. You can contact us via DM or comment on our posts, or you can email us at info@fxregencenter.com. So without further ado, I'm going to get into the hands. And first, in order to understand the different things that can cause arthritis in the hands, first we got to understand what's the anatomy of the hands, and also what are the different things, what does arthritis mean, and why is it not always painful? What are the different things that can cause arthritis to become painful? So I'm going to go through all of those today. So to talk a little bit about the anatomy, first we're going to look at this program by BioDigital here that goes over the anatomy of the hand. Let me see here. This is a cool little program here that kind of goes through the anatomy in general. We're going to take a look at what that looks like. So when you look at the hand, kind of this outline that you see around it is your skin, but right now we're looking at a lot of different things. Specifically, we're looking at the skin over here. We're looking at tendons that connect muscle to bone, and below that we're actually looking at some of the bone structures themselves. So we're going to go kind of dig deeper into the layers here, and we're going to slowly peel back the layers of the onion until we get to really just the bone itself. And here now we can see that the hand and wrist are constructed of several different bones. And we're not just talking about the bones of our fingers, but we're talking about several bones that are inside the wrist itself. So first of all, what is the wrist? What is the hand? What classifies as each of those areas? The wrist is where your forearm here comes and attaches down to your hand. So if we look at our hand here, this is our forearm, this is your wrist that's surrounded by my other hand here, and then this is your hand into your fingers. The wrist is actually several different bones, as you can see here, and there's two rows of bones. There's the row that's closer to the hand and your fingers, and then there's the row that's actually closer to your forearm bones. And when you really zoom in, whoa, zoomed in a little bit too much there. When you really zoom in, you can see that not only do we have these bones that articulate with each other, but these bones articulate each other with these smooth surfaces called the cartilage. This is similar to other joints in our bodies. Joint is where one bone meets another bone, and where those two bones meet, there is a smooth surface called the cartilage that allows for nice smooth movement. And the wrist is no different. Now, where the wrist comes and attaches to the rest of the hand, we definitely have that articular cartilage in these areas as well. Now, really, any place where we have a joint and where we have that articular cartilage is, in theory, a place where we can develop osteoarthritis. So arthritis can occur at any joint in our body. So what are the different joints? We have your carpal joints, which are the joints of the wrist bone here. We have your joints that reach into the forearm region here, which is a joint between the radius and the scaphoid. You have a joint between the radius and the ulna, which are your two forearm bones here. And these are joints that can get involved with various wrist pain conditions as well. Now, beyond the wrist region, we have the bones of your hand, which include the metacarpal bones here. Now, even though these look like fingers, these bones are actually within the hand itself. And it's not until we get to your phalanges where we're getting into the fingers that are what we conventionally think of as your finger bones. That's really all I had to say about that. Now, there are plenty of places where arthritis commonly can occur. One of the most common areas for arthritis to occur in the wrist and hand is actually the joint where the thumb metacarpal comes and meets the carpal bones. And this joint is called the CMC, or carpal metacarpal joint. And we have carpal metacarpal joints at all of these areas of our hands, but the thumb carpal metacarpal joint is one of the most common joints to get osteoarthritis as we're getting older. And why is that? What happens? What causes osteoarthritis to occur there? Well, our thumb, unlike a lot of other animals in the animal kingdom, is an opposable thumb, and it can rotate and move in various different directions. So that significant amount of articulation or movement that occurs in the thumb can also allow for us to have more wear and tear occur there if we are moving abnormally. So what does that mean? When we're moving, this joint here can slowly wear and tear over time. This can occur in all of our different joints, but ultimately this is one that is more common because of the multiple ranges, multiple directions that can travel in, right? If you think about the joints of our fingers, certainly those can have a lot of wear and tear, especially depending on what kind of work you do, what kind of sports you play, etc. But ultimately these fingers are really hinge joints. They only move in one direction primarily. Whereas the thumb, it actually moves in multiple different directions, and therefore there's a lot of ways that you can get some wear and tear occurring there. So what is osteoarthritis? What is this wear and tear that I'm talking about? Osteoarthritis really is multifactorial. There's a lot of factors that go into what develops osteoarthritis, including things like genetics. But if you really try to simplify it as much as possible, osteoarthritis really just equals wear and tear. So as we're moving, as we're acting, the smooth surface, the cartilage starts to wear away, and then the bone underneath the cartilage starts to get a little rougher. Now, there's other factors that are involved. For example, each of these joints has ligaments that surround them. So if you can see this now, I'm going to get that into view a little bit better here. And when we start to add on some of the layers here, you could see that there are these structures that connect all of these bones together. So what are these structures? Well, these structures are ligaments. Ligaments are, some people describe them as the duct tape that connects bone to bone. And you can kind of picture that here. It kind of looks like it's tape connecting, Scotch tape maybe, connecting all of these bones together. But these are supportive, strong structures. Now, the reality is the makeup of these ligaments is actually more like those thick rubber bands that surround broccoli in the grocery store. If you've watched my channel before, you've heard me say that. So if you can imagine those thick rubber bands, they're strong, they're supportive, but there's a little bit of a stretch to them, right? So now let's say we have those thick rubber bands that are surrounding this carpal metacarpal joint. And depending on how we live our life, what we're doing, right, we're using our hands all the time, and we're gradually over time slowly stretching those ligaments. Now, if those ligaments are getting looser over time, then there's some more play that can occur in the joint. There's some more motion that can occur in the joint. And that can allow for the smooth surface to start to wear away more. In addition, the bone underneath the cartilage, I said that changes when we start to have osteoarthritis forming. When we have that wear and tear, the bone can get rougher. And in some circumstances, the bone can actually react to that extra motion that we have there. Right? If our ligaments are loose and the joints are moving a lot, the bone could be like, hey, there's a lot of motion here. I gotta bulk up. I gotta get, stronger, and I gotta actually react in order to decrease that instability that's there because the ligaments are loose. So the bone actually can bulk up, and that is called a bone spur. So over time, as we have some more motion that's taking place here and the ligaments are getting looser, the cartilage starts to wear away and the bone starts getting bulkier. All of that is a part of osteoarthritis. Now, over time, we can have some other things occur in that bone, namely, over time, if we continue to put abnormal pressure into the joint, then the bone can actually start to break down. And that's called necrosis or avascular necrosis when it's due to decreased blood flow. And those are really the end stages of osteoarthritis. Those are the end stages. And what's interesting, though, is that with the exception of those end stages, the remaining kind of spectrum of osteoarthritis does not necessarily equal pain. In fact, it's very common. You've all heard this before. It's very common to have osteoarthritis and have no pain associated with it. So what exactly can cause pain to occur? What is it that causes that joint to become inflamed or causes that osteoarthritis to become bothersome? Well, really, first and foremost, when a joint has osteoarthritis, the local environment is not as healthy. And it's easier for that joint to get irritated. It's easier for that joint to stay irritated. But how is it that the joint gets irritated in the first place? Well, number one is if we're using our hand abnormally, right? If as we're getting arthritis as we get older, some of the things that we used to do when we were kids might not be something that's tolerated when we're adults. So if you're used to doing a lot of things with your hands, playing guitar, playing piano, various different things that we grew up doing, but as the ligaments get looser and as the osteoarthritis gets worse, it's easier for that joint to get irritated when you're doing these activities. The other factor that can play into causing irritation to the joint is if we have imbalances of our musculature. If our muscles aren't strong, if they're not working properly, then we can put abnormal pressure into the joint as well. So what are the things that can cause our muscles to work abnormally? Well, the imbalance of the muscles can occur if the nerves going to those muscles are not firing properly. That's one of the things that can cause these various muscle structures to not work properly. And I had a patient today that I'm going to go through a kind of an example of to demonstrate how that is possible. But there are other things that can cause the muscles to work improperly. If we have an injury, if we stub our thumb, or if we fall onto our hand, these are various different things that can aggravate both the muscles and the joints and cause a joint that has osteoarthritis to become painful. But I'm going to give you an example of today a patient that I had that has arthritis in his thumb, that is his primary pain generator. But I'm going to explain how his muscles and his nerve irritation actually plays a factor as to why that is becoming painful. So this is a patient that has had osteoarthritis in his thumb for X amount of time. It's been going on gradually over the years, but things have gradually gotten worse in terms of pain. I dug a little bit deeper into his history, and in addition to the pain in the thumb, he's also admitted to having some numbness tingling into his thumb fingertip, and at the tip of his thumb, he actually feels some numbness, like he can't actually feel. So I dug a little deeper, and it turns out that he had a couple different surgeries in his neck, and he used to have pain going down his arm. That pain down the arm actually improved with surgery, and overall the surgery was successful. So sometimes surgery is absolutely necessary, right? But residual, sometimes he could feel some tingling and things going down his arm, and I had the sense that something was still going on in the neck that was potentially contributing to the stuff down here. So then I examined him, and when I examined him, clearly the thumb was the main issue. I did a diagnostic ultrasound of the thumb, and I can see that there's arthritis in there. I pressed on it, and it was clearly painful. I also checked this side of his wrist because I saw that he had some pretty decent atrophy or muscle loss in the base of his thumb, which can occur when we have arthritis here as well. But in light of the fact that he had some numbness tingling into the thumb, I was like, you know what, let me check for this thing called carpal tunnel syndrome. And we'll talk next week or so about carpal tunnel and explain exactly what that is. But the gist of it is that there's a nerve that travels through here. And if that nerve gets irritated, it can cause numbness tingling into various fingers. But that nerve is also in charge of various muscles, including the muscles of the thumb, some of the muscles of the thumb. Now, when I examined him further, it turned out he had some weakness of his wrist, and he had some signs of numbness along his hand over here that was pointing to the idea that the nerves are still irritated over here. So the nerves here were causing some weakness in the wrist muscles, which surround the thumb, and that's these muscles here that form these tendons, okay? And he had some weakness of his thumb muscle here from nerve irritation over here, from the carpal tunnel, which is the muscles across the thumb on this side. So the nerves are the electrical wiring that go to our muscles. If the nerves aren't firing properly, the muscles aren't going to fire properly, and that puts abnormal torque or pressure into the thumb joint. So that can contribute to the osteoarthritis, and in addition to contributing to the osteoarthritis and the wear and tear, that imbalance of musculature can then contribute to the osteoarthritis becoming painful. So all of these things are connected, and it's not enough for us to just say, hey, I have pain in my wrist, that's arthritis. We have to take a step back and ask the question, why is that occurring? What are the other factors that are involved? So for this particular patient, we're likely going to do some PRP, or using his own blood growth factors, to inject into the thumb joint and also around the nerve of the carpal tunnel. But we're going to do some physical therapy and exercise to, again, strengthen not only the muscles around the thumb and the wrist, but also to strengthen the muscles of the neck, to take pressure off of the nerves, get those nerves firing better, and really try to treat the whole picture. But that was a complete tangent. That was just happened to be a patient that I saw today that has arthritis of his hand and wrist, and it's just an example of us not only paying attention to the arthritis, but looking at the whole picture. So overall, the gist of it is that the wrist and hand is made up of multiple different bones and joints, and there are several joints that could develop osteoarthritis or wear and tear, and that can happen for various different reasons. Ultimately, that osteoarthritis is a spectrum. It starts off with a little bit of motion in those joints. It starts off with the cartilage starting to wear away and the ligaments starting to get looser, and it ends with the bony changes that can occur. Bone spurs, the roughness of the bones, and eventually the breaking down of the bones is all in the spectrum of osteoarthritis. None of which has to equal pain unless it's really just breaking down at those end stages. And a lot of times there are other factors involved, including the ligaments, the muscles, and even in some circumstances the nerves that go to the various muscles of the area. It's very, very common for us to have osteoarthritis in the hand, in the fingers, in the wrists. And it's something that we can manage conservatively and very commonly. There are some surgeries that could sometimes be beneficial, and some of these surgeries, however, have a very, very long recovery and sometimes even a painful recovery. When surgery is necessary, it could actually be a game changer, though, and there are some surgeries that could be absolutely beneficial. However, there are a lot of risks that we need to consider, so it's certainly not something that we want to jump to. We certainly want to try to manage things as conservatively as possible with things like hand physical therapy or occupational therapy, bracing that can help stabilize the joint, and various injection treatments that can help with not only the pain but also the joint biology and stability itself. Hope all that made sense. Overall, if you have any questions about the hand, wrist anatomy, about osteoarthritis, or about anything else, feel free to comment, DM, or email us at info@fxregencenter.com. If you liked this video, if you found it helpful at all, then please share it, like it, and spread the word. We're going to be talking more about the hand and wrist as the next couple weeks go by. We'll talk about carpal tunnel syndrome. I'll do a physical examination and an ultrasound of the wrist and hand. And we'll keep on learning about different things as